and welcome to the ST3 webinar today. I'm Abira, I'm the Chief Organizer of UKRST, and thank you for joining us. I'm ST5 Clinical Radiology, Neuroradiology Fellow. I'm working in Oxford, and I'm just finishing my training in next 2 weeks. So I've got with me Mohammed. He's ST4 registrar currently. He'll be stepping up as ST5 next month, and he got into ST3 training 2 years ago. He's prepared this webinar for you. So this webinar is mostly focused on the training itself and not how to get into the training. So it's just to make you familiar what to expect when you enter ST3 level training. And then Mohammed will go through what he will cover. And then obviously, because you are not starting off as ST1, which is the normal duration of 5 years of training, where you will be entering right in the middle. So you will be joining a cohort. So obviously, some of you may have previous NHS experience. And if you don't have, please can I ask all of you to mute yourselves? So yeah, as I was saying, it's really essential to know what the requirements are throughout your training, and Mohammed will go through it. And if I can ask you guys, if you have any questions, just put them in the chat box, and I will try to answer them as we're going through. And also we'll take questions at the end. But I would really request if you can keep your question towards the training, like any questions you have regarding the training itself rather than the recruitment process. So I've got with me Mohammed, and I also have got Dalia, who is our organizer of UKRST. So Mohammed, on to you.
Hi everyone, my name is Mohammed Basyouni. I'm as Abira introduced me, I'm one of the trainees in the Northwest, and I'm currently doing cardiothoracic training in the Northwest. So I thought I'd give this presentation to prepare you for the training. The target audience of today is the people who are starting training in August. So if you are not starting training in August or have not been into the training program, not been accepted in the training program, then this presentation is not for you. It is a long presentation. It will take around 1 hour or so. We'll discuss some of the key components of the training portfolio, ARCP, and all things like that. Let me just start sharing my screen, if that's all right.
Yes, sure. Yeah. Yeah, I can see your screen.
Thank you. So first of all, for those of you who are starting training next year, whether in August or after, congratulations. Welcome to the training program. These are some of the things that we're gonna discuss today briefly. We're gonna try and cover as much as possible briefly. Don't feel overwhelmed with all the new things that you're gonna hear today. You will keep hearing these things over and over throughout your training. This session today is just to get an idea about these things rather than starting without any sort of support. So to start with your training, there will be at least 3 responsible organizations. First of all is Health Education England and the Deanery. They are responsible for your education and training. They're responsible for recruitment. Also responsible if you want to go out of program or apply for less than full-time, as well as applying for study leave. In some areas like the Northwest, you will have a lead employer. A lead employer will be responsible for all the employment services, HR services. They will pay you and issue your pay slips, and also they will provide you with occupational health support and sick leaves. And then the lead employer and the deanery will send you into rotations. So the rotation or the hospital you're going into is what we call the host organization, and this will be responsible for your day-to-day supervision and responsible for your attendance, approve your expenses, and provide you with your day-to-day work schedule as well as on-call rota. In some areas, there is no lead employer, and it's just the host and the deanery. It depends on which deanery you are part of, but at least this is the structure in the Northwest Deanery. So moving on, in terms of the timeline of the training, so as you know, the training in the UK is made of 5 years. So you are starting at ST3. Hopefully, after you finish ST5, you will get the CCT, which is the Certificate of Completion of Training. And then afterwards, you can either go for a consultant job or a fellowship. I just put this here to tell you that the transition between ST3 and ST4 is what is called a critical progression point, which means you have to fulfill all of the milestones, particularly the FRCR2A and all of the other curriculum milestones to progress to ST4. Otherwise, your training might be extended and you might still be called as ST3, or some areas call it ST3 plus. So that is what is unique about ST3, is that it is a critical progression point. We'll get into details about what this means when we discuss the curriculum and portfolio in a few minutes. So what's the difference between CCT and CSER CP? So CSER CP is the Certificate of Eligibility for Specialist Registration via combined program. Those of you who are starting at ST3, we were told that we will be giving CSER CP, and eventually the GMC will change this to CCT after training. The old regulations before the Brexit was that for you to get a CCT, you will have to be in training program at least for 4 years. We have been told, we have been informed that this is going to change because of the Brexit, and this was some sort of an EU regulations, and all of us are going to be granted CCT. We'll see what happens when the first ST3 cohort finish the training, which is next August. But hopefully you will be granted CCT. So in the UK, there is no difference between CCT and CSER CP. They're essentially the same. You'll become a consultant, but it might be of importance for those of you who want to work outside the UK. For example, EU or Gulf countries, there is a big difference between having a qualification of CCT and having a qualification of CSER CP. Obviously, CCT is more recognized. So going back to your timeline, first 3 years of training are generally called clinical radiology training or general training. And the second, these ST4 and ST5 are the years where you're supposed to get your subspecialty training. So you get to choose your subspecialty based on competition, and you are supposed to train into this subspecialty with maintaining your general skills. And then you get your CCT. There is an extra year if you are applying for interventional radiology. So the interventional radiologists will spend 3 years of specialty training until they finish ST6. So let's touch down about subspecialty training in brief. So again, the application process is variable depending on the deanery. So each deanery has a different application process. If you want IR or neuro, there is usually a separate process. For example, in the Northwest Deanery, you are invited to send your CV and cover letter to the TPD, and then you fill a form to apply. If there are too many applicants, you will be shortlisted for an interview, and then you will have an interview with the TPD and someone from the neuro or IR program, and the panel will select candidates based on the competition, based on your CV. In the Northwest, this usually happens in November when you start an ST3. So you don't have a lot of time to prepare. If you have IR or neuro in mind, then you better start preparing your CV and portfolio. And some deaneries, they might have extra vacancies, so they might accept trainees from outside the region. So, for example, if you are in the Northwest and you couldn't get into IR, you can still apply for IR positions in different in other dinaries because you already have a training number. So you can approach other dinaries and see if they have extra vacancies. Apart from that, most other subspecialties are less competitive, except maybe breast and peds. But hopefully, apart from that, you'll be able to get your desired subspecialty. For the other subspecialties, there should be an application process depending on your dinary. For example, in Northwest Dinary, you will fill a form in November, and you will choose what kind of subspecialty you want for the next 2 years. And by the way, you can always change this later. You can have a subspecialty in ST4, and if you don't like it, you can change it for ST5. In terms of the salary, this is a bit of generic information. The salary, the up-to-date salary, I think is 55,000 per year. There is no pay protection for those of you who are coming from another NHS job. There is no pay protection. On-call supplement depends on the dinary. How many on-calls are you doing and frequency? In some rotations, maybe in some rotations there are no on-calls at all, so you'll just get to have the basic salary. You are allowed to take locums in your own time. External locums should be declared at the time of your ARCP. We will discuss in a minute what is an ARCP, and you should declare the locums in Part B of Form R. We will also discuss in a minute what Form R is. So what is Form R? It is a form that you need to fill annually and update it in year if there is a change. It has two parts. Part A is just personal and contact information for the dinary database. Part B is the part where you fill about your scope of practice. Are you doing any other extra practice outside of your training? Have you had any time outside of your training? Time off? Have you had any extended sick leaves? This information is used for your RCP, and also this information is relayed to the GMC for your annual appraisal and revalidation. So Form R is a very important form that you need to fill annually before the end of the year. Okay, let's discuss supervisors. I'm sure some of you already have heard about educational supervisors and clinical supervisors and all of these terms, and they might not know what the difference between different kind of supervisors. So these are the the positions, the main positions that are there in the training that will be supervising you: head of school, TPD, PSTL, ES, and CS. We will discuss briefly what everyone does and when should you contact every one of those. Oh, sorry, it's the other way around. So training program director, they are responsible for leading and coordination of the training. They will assist in your appointment and training, and they will assign you with your educational supervisor. They might monitor and inspect the training placements, and they will allocate your placement. So in most of the dinaries, you have rotations, which means you will go to a different hospital every set amount of time. For example, every 6 months or every 1 year or every 9 months, depends on the dinary. In the Northwest, it's every 6 months. So these rotations are allocated based on the TPD. They will also approve your study leave, application for less than full-time, and application for time out of training. The educational supervisor, this is a consultant trainer. He or she are responsible for your overall supervision, and they are responsible for your learning and educational progress. They are the first point of contact outside your placement. So if you have any issues, if you need any sort of guidance outside of your placement or rotation, you should always contact the ES first before escalating to the TPD. You will have one ES throughout your training. So usually your ES doesn't change throughout your training unless you apply, for example, for IR or neuro, then you will have a consultant from IR or neuro assigned as your ES. You need to have at least 2 to 3 formal meetings with them. And by formal meeting, we mean a meeting that it will be logged and registered into your portfolio. The final ES report is very important. It is the final report written before your ERCP, and basically it is a very important document that the dentary will check and read to check whether you are qualified to progress to the next training stage or not. TSTL, or Trust Specialty Training Lead. Each radiology department in each hospital has a TSTL. This is basically a consultant who is a link between the department and the dentary. They will be issuing your day-to-day schedule, and in some cases, they will be issuing your on-call rota. They will assign you a CS. Sometimes they are known as college tutors. They will also sometimes approve your annual leaves. So this is a person in each radiology department, in each rotation, that will help you with your training requirements and work schedule. And obviously, if every time you change a rotation, you will have a different TSTL. Clinical supervisor. This is a person overseeing your training clinical work, and they will give you feedback about your training. You will have one CS each placement, and you need to have at least 2 formal meetings every rotation, and this should be logged into your portfolio. So this is just a scheme of how the structure works. Dentary at the top is the head of school. Usually you won't need to contact the head of school. And then there is the training program director who will assign you with an ES. And then in each rotation, the TPD will send you to different rotations. In each rotation, you will have a ESTL and a CS. So probably you will have a single ES throughout your training, and probably a single TPD throughout your training. In some dentries, there is a TPD for ST1 and ST2 and ST3, and there is a TPD for senior trainees at ST4 and ST5. So this is the only occasion you will have multiple TPDs. So in terms of job rota and work schedule, I hope that by now, those of you who are starting in August, you should have received your work schedule. Because by law you are supposed to receive it 12 weeks before the start of rotation. The rota should meet your educational needs and subspecialty preference. So for example, if you're going to a general hospital and you're doing a general placement, you should have a general rota. By a general rota means that you have enough CT sessions, ultrasound sessions, X-ray, and general MRI sessions. You're doing, for example, cardiac, and you're going to a hospital that has cardiac radiology, cardiac subspecialty, you should have some cardiac CT sessions and some cardiac MRI sessions. So this rota should fit your needs. If the rota doesn't fit your needs, then you have to discuss it with your TSTL. You should receive the following before each rotation: your work schedule, your on-call rota, TSTL details, and CS details. If you have not received these by now, then you should contact the dentary or the host organization and request these details. And also you should have received your induction details, because I think you guys are starting in a couple of weeks now. So in terms of the curriculum, the RCR has recently updated the curriculum. So the up-to-date curriculum is 15th of May 2023, and there were some changes that have been introduced. You will hear these descriptors a lot and when you perform procedures or when you do assessments for your portfolio. You just need to focus on these 4 levels. For anything you do, you are assessed, and you're getting one of these 4 levels. One is you are entrusted to observe only. 2, you can work under direct supervision. 3, indirect supervision. And 4, you can work unsupervised. And this is plotted against each assessment. So for example, if you have an assessment in ultrasound, your assessor will give you one of these levels, and you need a certain level for each stage of training. So let's check the next slide. So these are the milestones, the up-to-date milestones for the training. So you are at ST3, for example, image guided biopsy, you need to sign an assessment that says you are at least at level 2, which means you can do it under direct supervision. The levels gets higher with some of the reporting and fluoroscopy and CT and MRI sessions. So we need to have achieved all of these levels by the end of ST3. It would be useful if you have this with you throughout your training to check what levels you need to achieve by the end of the year. And you can see FRCR2A exam is also mandatory, so you have to have this done before finishing ST3. As you can see here, it is a critical progression point to progress between ST3 and ST4. If you fail to achieve even one of these, your training might be extended and you won't be allowed to progress to ST4 unless you finish the missing milestone. There are some other generic milestones that you also need to achieve. Have a read about these. These are generic stuff like your professional values and how to integrate with the team and things like that. And also you need a specific level at the end of your training. And these will be assigned to you by your ES. You should discuss with your ES if he or she are they're happy to give you this particular level, and if not, you should discuss with them what to do in order for them to give you the required levels. Again, this is all written in the curriculum, and I'll give you the link of the curriculum in a minute. So this is the link. It is on the RCR website. If you Google RCR curriculum, that's a link. I advise you to read a little bit, particularly these couple of tables. They are very important. So let's move on. So we have something called workplace-based assessment. These are essentially the assessments or the tools that will assess your performance throughout your training. As we said, these are tools to assess your performance. There are different types of tools depending on what is being assessed. So there are tools to assess your reporting. There are tools to assess your procedure capability and teaching capability. You need a minimum number of assessments per year. We'll get into details in a minute. You also need to achieve a minimum level for each item being assessed. For example, level 3 or 4 or 2, as we have shown earlier. Before being assessed, you should agree with the person who is assessing you that this will be assessed. So for example, if you are reporting a session with a consultant, you should, before starting reporting this session, ask them that you want to sign off an assessment ticket so that they can have the chance to assist you properly. So let's get into details about what different tools we have to assess your portfolio. So these are the different tools that will be available on your portfolios, and you need some of you need to complete most of these for your portfolio from time to time. We'll get into details what each one of these mean. But this is essentially a summary. MSF is a feedback about you. Mini IPX, this is a tool to assess your reporting skills. RadOps, a tool to assess your procedures. Teaching is to assess teaching. MDTA for MDTs. UIPAT for audits. Let's start with MSF. So MSF, essentially, you send 12 persons a ticket to give their professional opinion about you. Ideally, you should have a group of 2 to 4 senior doctors, 2 to 4 doctors in training, radiographers, nurses. So try and make a mix. And this is the form that they will receive. So as you can see, these assess your professional manners and your integrity, whether you have good communication skills, you respect the patients, you respect your colleagues. So you need to complete this once per year, and you need 12 people to respond. And this is what is called MSF. It stands for multi-source feedback. Next is Mini IPX, and this is essentially a tool to assess your reporting skills. This can be X-ray reporting, it can be CT, MRI, any sort of reporting. So you need 6 per year at least, and ideally 2 every rotation. And this what you're gonna fill when you are completing the assessment. You're gonna put down your specialty, what kind of modality is being assessed, what kind of system, for example, GI, cardiac, thoracic, neuro, etc. Describe the cases and describe the setting and give any comments about your performance. And then you send the ticket to the consultant or the person who's assessing you, and then they will fill this. They'll fill their details, and they will write some comments about what has been done very well and what are the areas of improvement. And most importantly, they will give you an entrustment level, level from 1 to 4. So this is the most important bit because you need a certain level for your portfolio, as we've shown earlier. Let's say, for example, you need level 3 for CT. It is okay to get level 2 at the beginning of the year. There's no problem. As long as you reach level 3 towards the end of the year, it should be fine. RadOps, it is a similar tool, but this is a tool to assess your procedure skills. So the procedures could be ultrasound, could be biopsies, could be drains. RadOps can be filled by a consultant or a senior doctor or a person who is qualified in doing this procedure. And this is quoted from the RCR curriculum. Again, you need 6 per year and ideally 2 per rotation. And again, you need to fill your assessment tools based on these levels. So these are the levels that are needed for your milestones. You need, for the biopsy, you need level 2, which means you can do it under direct supervision. And most of the reporting stuff are level 3. So that's just keep this again in mind. Teaching observation, it's a tool to assess your teaching capabilities. And you need 2 per year. So you need to have 2 formal teaching sessions assessed per year. You need to obtain feedback from those who are attending the teaching session. And you can put this feedback in your portfolio or send it to the person who is assessing you. Usually it is a consultant who will be assessing you. For example, you can teach medical students in your hospital. You can teach your junior doctors, even your trainee colleagues, or you can even pick up an article and give a teaching for the consultants. It doesn't really matter who the audience is. MDT, it is a ticket to assess your MDT. This is not required for ST3. So if you want to do it, that's fine, but it is mandatory for ST4 and above. So don't stress yourself about it. It is just that you know that this is a ticket to assess your MDT presentation skills. For ST4 and ST5, you need 2 per year. For ST3, you don't need anything. So this is QIPAT. It is a tool to assess your ability to do an audit or a quality improvement project. You need to do 1 audit per year. This is mandatory. And you can attach on your portfolio the audit certificate and the summary of conclusion and recommendations, and you need a consultant to sign you off. What other things you can do on your portfolio? You can do a supervisor review meeting. So when you meet with your ES, you will have at least 3 meetings per year, 1 at the beginning of the year, 1 at the middle of the year, 1 towards the end of the year. For each rotation, as we said, you will have a CS or a clinical supervisor. Again, you should arrange a meeting with your clinical supervisor, and you should have at least 2 meetings with your CS at the beginning and the end of rotation. If your rotation is for a full year, then ideally you would have a 3rd meeting with your CS at the middle of the year. I don't know, Abira, are there any questions so far? Just to give the people a bit of break.
No, there have been no questions so far. I think some people are asking if we can arrange a webinar on the recruitment process, which I said we can. Fully, yeah.
Yes,
If
sure. We'll
guys,
keep
if
that
you
in
have
mind.
any questions, just put them in the chat box regarding training.
Okay, so let's carry on. Just one more.
Someone has asked about ST3 on-call expectation, so I think you probably will cover that. Or
Yes, yeah, I think it's covered in briefly in coming slides. There is something called PDB, and you need this at the beginning of year, which is essentially the plan for your next year. Every year you need to complete a PDB and attach it to your portfolio and link it to your ES and CS meetings. Your PDB should include what are your reporting goals for next year, what are your procedural intervention goals, audit, teaching, MDT, and research if possible, and also any other thing that you want to include in your PDB. Just my advice to you here is that keep your PDB reasonable. Don't write unreasonable stuff, because at the end of the year, your ES and the panel will check your PDB. So ideally, you should have completed all the goals in your PDB. How to fill your PDB on Kaizen? You will have the option to in the previous Kaizen there were set categories that you need to fill. In the new Kaizen, you have the option to do custom categories, so you can put these 5 categories, for example, and put your goals for the next year, or you can put any other goals you want. But this is just a suggestion. A suggestion for how to fill your PDB. What is the objective under each category? How are you going to address it? What evidence you will provide? For example, I will provide certificates, or I will provide assessment tools. And when do you expect to complete this goal? So we fill these 4 criteria under each of the categories in your PDB. Again, this is just a guidance. You don't need to just follow, you don't need to follow this with the exact same categories. So going back to your training timeline, as you said, throughout the year, you will do many assessments to put down in your portfolio. One suggestion that I have to you is to spread out your assessment, because this is the worst thing that you can do for your portfolio. You do a couple of assessments at the beginning of the year, and then you put everything in your portfolio towards the end of the year, and the rest of the year you have not put anything in your portfolio. This looks bad in your portfolio, and the panel will not like it. And you might even have an unfavorable outcome. So try and spread out your assessment throughout the year. So in the next part, we will address Kaizen, which is the e-portfolio provided by RCR. We call it Kaizen. It has always been named Kaizen, but recently they have changed the website, and it's now called RISR. So essentially, both are the same thing. When you go to your Kaizen, you will have a dashboard and the option to add all of these stuff. In time, you will learn what to do with your portfolio. But for example, these are the assessment category, and these are the different assessments. I don't know if you can see my mouse. These are the different assessments that you can choose and fill, and then send it to one of the consultants. And these are some other stuff to assign educational supervisor and things like that. I'm just gonna zoom in here. So in the supervision part, when you start the year, you should assign your educational supervisor. Ideally, your educational supervisor name should have been sent to you by now from the DINRI. You just go here and assign your educational supervisor, write down their name, and write down the period where they're covering you. They should be covering you for the entire upcoming 3 years. You also should assign your training posts. So for example, if you are starting at a certain hospital next year, next August, and you're going there for 6 months, you go here and write down the name of the hospital and write down the dates where you're starting and finishing that particular hospital. And also you get to write down the name of your clinical supervisor. The reason you need to go to your portfolio and add the name of your ES and CS is that you will give them the permission to access your portfolio and to write down their meetings with you formally, and they will be able to see your assessments. Otherwise, you won't be able to go through with the meetings. Some of you might not have access to Kaizen already. Don't worry about it. Just just email RCR, and usually you will be able to access Kaizen once you start your training. One of the things you need to do when you start with the year is to do an educational supervisor report, and this where you can start it and fill in your initial details and send it to your educational supervisor, and then your educational supervisor will fill in the rest of the details, and also a clinical supervisor report, same thing. ARCP. So we have mentioned the ARCP multiple times so far. For those of you who don't know this, I think this picture tells a story. So essentially, ARCP is stands for Annual Review of Competency Progression. It is an annual review which checks your competencies and checks whether you are allowed or you're competent enough to progress to the next stage of training or not. It is done towards the end of each training year. Unfortunately, it is done usually in late June or July. And this is kind of a problem because this means that you don't have 12 months to work on portfolio. You actually have less than 12 months. You have around 11 or 11 and a half months. So you need to start working on your portfolio as soon as possible. You're not required to attend this annual review. A panel of assessors will assess your portfolio and give you an outcome. If your evidence suggests unsatisfactory, you will be awarded with an outcome that states the action and time scale to correct the deficiency. These are some of the outcomes. Ideally, you want an outcome one, which is satisfactory progress. And hopefully by the end of ST5, you get outcome 6, which means you have completed all of your training requirements. You can read about the outcomes later on, but this is just a quick summary. And this is the invitation of the RCP. Usually, you will a few weeks earlier you will get an email telling you that your ARCP date, and you need to have all of your evidence ready in your portfolio. What are some of the evidence needed for the RCP to make a decision? Again, this is just a guidance. This is how it is like in the Northwest. It might be different in other deaneries. You need to have completed all of your workplace based assessments, which we discussed earlier, the assessments for your reporting and DOPS and MSF and everything. And you need to have acquired the correct level. As we said earlier, there are levels 1, 2, 3, 4. You need to have ES reports, induction or beginning of year report, and end of year final report. The ES report is one of the essential components of your ARCP. Because this is the first thing that the panel will check. If your ES thinks that you have done well in your training stage, then it is usually, and you have also done the correct amounts of workplace-based assessments, then it's usually a done deal. You need to have uploaded your Form R, which we discussed earlier, Form R A and B. Keep in mind that you will be sent training surveys throughout the year. Some of these training surveys are sort of mandatory. You need to fill them and provide evidence that you filled them, at least in the Northwest. So these two particular surveys, the GMC training survey and the Health Education England survey, I think it's called NETS, N-E-T-S. So watch out for your emails. If you get these surveys, fill them as soon as possible and save the evidence that you have filled them. In some dinners, there is a logbook which you fill, and it just mentions the number of CTs, MRIs, ultrasound, and X-rays you've completed throughout the year. You need your PDB, which you have filled in at the beginning of the year. In some dinners, there is mandatory teaching attendance. You'll have some mandatory teaching days. So if you have this in your dinnary, you should keep the evidence or any certificates to upload it to your portfolio. You will need some annual leave records, records of your annual leaves taken from each hospital. And for SC3, you need your FRCR2A certificate uploaded. Even if you have finished FRCR2A already before starting the training, make sure you upload, because the panel doesn't know that you finished your 2A exam. Make sure you upload your 2A certificate. Any other achievements or certificates that you've done throughout the year and you feel it's helpful, then you can just upload it. In terms of annual leave evidence, this is just an example of an annual leave form in the Northwest. I don't know how it's like in the other deaneries, but you need to sign this from your training supervisor in each rotation. And you just write down the number of days of annual leave for annual leave, study leave, and sick leave. In terms of logbook, this is again something in the Northwest. We just fill it towards the end of the year. How many CT heads, how many X-rays and MRIs and ultrasounds we've done. So before moving to the next part, any questions so far?
No, someone had asked about what areas to focus on your CV for IR training, but I've answered.
Okay. So let's move on to the next part. I know there's a lot of information to process. You will keep hearing these things again and again and again throughout the training year, so don't worry about it. At least you know now what's the right direction, how to research this stuff again. So don't worry about it. I'm gonna touch on study leave briefly. So study leave, you are entitled to 30 days per year of study leave. You have a study budget. Study budget is different from deanery to deanery. I've heard that some deaneries have unlimited study budget. I'm not sure if this is a rumor or not, but at least in the Northwest, you have 350 pounds as an ST3 and 500 pounds as an ST4 and 5. You can apply either for time only, which means I need time off only to study or to attend the conference, or you can apply for a time off as well as expenses. There is a process. Again, it's different from each deanery to deanery, but at least in the Northwest, you have to get ES and CS approval first, and then we have a portal where you can apply for a study budget. And then your TPD will decide whether to approve or not, and then we'll send it to the admin team, and they will give you the approval by email. So study leave is different from annual leave. You can also have your annual leave as well as the study leave. The approval is at the discretion of the TPD. So the TPD might not approve your study leave. It depends whether you are applying for something that has a purpose and serves has an educational purpose as part of your training. You need to apply 6 weeks in advance at least. And if you have expenses, you need to pre-approve them. So for example, you are attending a conference and you expecting that you will take trains and you will have accommodation. So you need to write down approximate expenses, and then you will claim it within 3 months from the date of the event. So what kind of things you can apply for study leave for? So conferences, courses, in some cases self-study. So there is a local policy for self-study. In the Northwest, you only allowed self-study for the 2A exam, and you are giving 7 days for the first attempt only. For the part 1 and 2B, you don't get any self-study days, but the actual exam day, you can apply for it as a study day time off. So courses, conferences, and self-study, as well as the actual exam day. Annual leave, this is a bit generic, but some of you have never worked in the NHS before, so I thought I'd just mention this briefly. The annual leave balance depends on how many years you have been working in the NHS. If you're just starting in the NHS, then you have 27 days per year, and the weekends do not count. If you have been working in the NHS for more than 5 years, then you have 29, and then you have 33, more than 10 years. In some places, if you're working more than 5 years, then they just give you 33 days per year. The annual leave is requested from your host placement. So if you need an annual leave, for example, for the next month, you should contact your TSTL in the hospital you're starting at. So don't contact your TPD or ES or anyone. They have nothing to do with your annual leave. You would contact your training lead in the hospital, and sometimes it's just one of the secretaries that you need to contact. You need to provide 6 weeks notice before requesting your annual leave. And it is your responsibility, unfortunately, to swap any on-call shifts, regardless whether you've requested an annual leave or not. Clinical duties, just gonna touch down briefly about this. Again, it depends on which dinner you're working at, whether there is on-call or not. In most dinners, you are expected to report plain films and acute CT reporting. However, these will need to be signed off by consultants. So someone need to check these. In some dinners, for example, I know for sure in the West Midland, you do some sort of X-ray exam, and you're allowed to sign off the plain films independently, A&E plain films like trauma, X-rays, and things like that. In the Northwest, you cannot sign off your X-rays. You need a consultant to check it unless you have finished the 2B exam. Yeah, that's what I've said. Some dinners will allow you to sign off plain films independently. Ultrasound and MRI reporting is done generally at ST3 level under direct or indirect supervision, depending on your confidence. I think for ultrasound, you're expected to sort of at ST3 work under indirect supervision. But again, if this is a totally new environment for you, don't be afraid in asking for your support, particularly for the first few months in your training. At ST3, you are expected to cover on calls independently. The consultant will be available off-site. If you need something, you can call the consultant. The on-call commitment is usually acute CTs, emergency CTs. Some places you might need to do emergency plain films and ultrasounds. Again, this is highly variable from place to place. Even within the same dinnary, it is variable from a hospital to the other hospital. Some rotations, you might not be doing any on-calls at all. You just have your day job from 9 to 5, and you just get your basic salary. I hope this has answered the question we got about the clinical expectations. I don't know if you want to add anything, Abir, about this.
Yeah, I think it's quite variable. So as I've mentioned, most of the deaneries, they do have a certain number. They might have a certain number for plain film reporting. Like in ST 1 year, like maybe 1,000 plain films, then 2,000 in second year. And you do have like an allocated plain film session in your rota. For the CT and MR numbers, I think it depends which rotation you're doing. But when you finish the block, I think your clinical supervisor can normally check on the CRIS, which is the Radiology Information System, like how many numbers you have reported. Like basically anyone can go and they can type your number, and then with your name, they can find out how much you have reported. So it's like it's very black and white. There's nothing gray. And yeah, but ST3s, you should be there. You're expected, you'll be signed off for your plain films, for your ultrasounds, and also to put up provisional reports for CTs.
Yeah,
and
thank you, Abir.
then
Yeah, go on. Sorry.
no, that's fine. Yeah, and we'll cover the on-call stuff, so we can answer. I think that would be the thing which most people are concerned about.
Yeah. In the Northwest, we also have a target plain film number, which is 1,000 per year for all stages of training. So again, it's highly variable. Yeah. So next, I'm gonna discuss briefly less than full-time. Some of you might want to work less than full-time, less than 100%. You need to give 16 weeks notice. There are like lots of eligibility criteria. Nowadays, anyone can apply for less than full-time. It's not a big deal. There are 2 windows per year to apply for less than full-time. Again, if you need more information, you should there should be an less than full-time rep or representative in your deanery. You can contact them. So for those of you who are sponsored or on visa, you need to hit a certain amount of because once you apply for less than full-time, your salary will be reduced. So based on the previous numbers from 2023, the minimum you can go as an ST3 was 41%, which is not too bad. Most people apply for either 80% or 50%. But please check the up-to-date numbers because the salary nowadays is not 51,000, it's 55,000. And also, I think the Home Office have changed some of the salary thresholds, so the number might be a little bit higher than 41%. Again, this slide shows the lowest percentage you can go down as less than full-time if you are sponsored by Health Education England. If you have a indefinite leave to remain or you have a British passport, you don't need to worry about this slide. I'm gonna touch down briefly on Radiology Academy because most deaneries nowadays have Radiology Academy, and essentially this is a place where you go and have a teaching either once per week or once every 2 weeks, once per month, depends. In the Northwest, you're expected to have a Radiology Academy teaching once every 2 weeks. Make sure you have a proof of attendance, or even like write down the dates where you attended, because you need to attach this to your portfolio. This image, by the way, this picture is from the Leeds Radiology Academy. We also have a Radiology Academy in the Northwest. Some of the sessions will be off-site, which means you will have the session virtually over Zoom, or you might need to go to the academy like you see in the picture. So the idea of having the Radiology Academy was to provide more teaching to trainees in non-clinical setting, particularly with the increased number of trainees. And in some deaneries, they have expanded the Radiology Academy teaching to ST2 and ST3s. And they also give you teaching for FRCR exams. So if you have a 2A or 2B exam coming up, make sure you contact your Radiology Academy. They might have some nice teaching sessions and teaching schedule for your FRCR exams. The teaching time at the academy is protected, and you should send all of your teaching schedule to your TSTL to release you from your day job. So whatever session you have on the day you have Radiology Academy teaching, you are allowed to leave your day job, but you need to tell your TSTL beforehand in advance. Keep a record of attendance, as we said. So I think this is we're approaching the final part of the presentation. This is the most important thing, which is planning for your year. We've mentioned lots of information. You have to have a plan for your year in order to have a successful ARCP outcome. First thing you need to do is to set up your Kaizen portfolio. You need to add your ES and CS to your portfolio and add the name of the rotation. If you already received your ES and CS names and emails, you should contact them, introduce yourself, and ask for a formal meeting. And then prepare your PDP to take it to the meeting and show it to your ES and CS. Once you have the meeting, you should write down all the details of the meeting formally in your portfolio. Usually your ES or CS are the ones who are gonna fill it down in the portfolio. You don't need to fill anything. Sometimes you just need to fill in the initial details and then send it to your ES and CS. But just to be clear, this is a meeting, a formal meeting that you will go and meet them either face-to-face or meet them virtually and discuss your plan for the year. Start your training and address your educational needs. Identify your weaknesses. If you feel you have a weakness in ultrasound, start working on it early on. If you have a weakness in your on calls, you can ask the rota manager to shadow for the first month. which means you attend the on-calls next to someone who is already on call and give you some leeway rather being stressed. So identify your needs early on and don't leave it towards the end of the year. It is better this way. It is better to address your weaknesses at the beginning and don't let yourself fall into problems. Collect evidence for your training. Again, collect all the assessments that you need, and your evidence should be spaced as much as possible. And aim to get the required level evidence for the relevant workplace-based assessment by the end of the year. And this what it means. Aim to get these levels towards the end of the year. It is fine if you start the year, for example, and get level 2 in MRI, no problem at all. Keep working on MRI skills, and hopefully towards the end of the year, you get level 3. So again, back to planning your year, keep in mind you need 1 audit per year. So keep that in mind. And at the end of each rotation, you need to meet with your CS formally. You need to do a mid-year review with mid-year meeting, essentially, with your ES. And next rotation, repeat everything. At the end of the year, before your ARCP, you need end of the year meeting, and you need to upload the ARCP documents. And additionally, every few months, you should update your logbook numbers and obtain evidence of your annual leave. So I'm going to show you an example of a timeline of the year. If your year is made out of 2 rotations in the non-ordinary, 1 year you will go into 2 different rotations. I'll show you an example of a timeline. So that's it. It should be your timeline throughout the year. You start the year by doing your meetings, and you're doing your job plan, and you start doing your assessment. At some point, you'll do a teaching and an audit, and then you start collecting multi-source feedback. And then towards the end of the rotation, you do a mid-year meeting with your ES and end of rotation meeting with your CS. And then you repeat the same thing for the second rotation. You are aiming to do all the meetings by the end of the year before the ARCP and collect all of the evidence before your ARCP. This is a similar example if your year is made out of a single rotation. Since you have a single rotation, then you aim to do a mid-year review with both your ES and CS. I think these couple of slides are the most important slides. It's just a summary of your year. If you guys want to have take a screenshot or something, then have a go. And before I finish, these are some of the resources that you might want to use. I thought this book was very helpful preparing for the on-calls for you all who want to prepare for the on-calls. This book is available on Amazon, On-Call Radiology, and this is the link of the curriculum. Please have a look at the curriculum, particularly the 2 tables where it mentioned the milestones. Have these milestones ready. When you go and meet with your ES and CS, show them some of them ES and CS. Some of the supervisors are not familiar with the milestones. You might want to show them the milestones. Keep it with you all the time to know your targets. And make sure when you start the training, you'd have access to your portfolio. I'm done here for now. So if you guys have any questions, I'm happy to answer any questions.
Thank you, Mohammed. I think that was quite detailed and you have covered lots of things. I think I've tried to answer. There are not many questions. They're saying I haven't received ESCS details and rota from the hospital. So I think you should contact the hospital HR, Momna. I think because every deanery is different, because sometimes the information we are giving, it might be a bit different from what you have in your deanery. I think I would just say a few things. Probably just everything has been covered by Mohammed. I would just say that once you start off, you will you'll have your proper induction. I think probably you are starting in August or in September. So you will have your induction with the new ST1s. So first thing is you have to just familiarize yourself with the hospital. If you have not worked in that hospital, just make sure your cards are working, you have access to all areas, and then your logins are working. You have access to packs before you start off your on calls and all those, like, it's the simple basic stuff. And your parking is sorted. How are you going to commute to the hospital? These are basic things, but I remember when I started off my training 5 years ago and I went to meet my ES, and I think the first thing he asked me was like, it wasn't related to like, training and everything. He asked me, have you got a house, and how do you drive? And how are you going to commute? And I think these were just like basic things which I found they were so important to me, and I just felt that connection with my ES, and I think it was really great of him. And I just finished I had my last ARCP and I finished my training, and I messaged him and I was like, I still remember you. You've been the best mentor. And then he practically guided me like wherever I wanted to go next. So it might be that he's of the same subspecialty interest that you have. If not, because they're working in a team, you can tell him straight off, because you're starting off in ST3. So if you have a background of like working in MSK or a breast or anything, just tell him like, this is my interest. What do you think I should do? And then he can put you in touch with his colleagues. So have a chat with them. And I think most important thing is, like, as international graduates, if you're coming in, sometimes you're very quiet, we are not really open, we don't ask the questions, simple questions. So I would just say, if you're not sure about anything, always ask, because if you don't ask, people will assume that you know everything, right? So just start off as a newcomer, as like a basic comer, because obviously the system would be different. Second thing, again, as I said, give your time to settle in, have a proper induction. If you have any issues, always speak up. And especially before starting your on calls. And I would say, discuss with your ES and your TPD before starting your on calls, and don't agree to start your on call straight away, even if they say that they're really short on the rota or anything like that. Just say, I want to do some shadowing on calls first, at least for a month or two. We had an ST3 who joined us, and then I think he did shadowing period for almost 2 months, and then once the consultant knew that he knows how to take the phone calls, how to refer the patients, even like simple things, how do you bleep someone, or if there's an urgent finding, how do you convey to the clinicians? You do have to do primary surveys on the trauma patients. Like, these are simple things, but then you will just learn it on the way. So give yourself time. Those initial first 2 months are like, probably sometimes they're a bit overwhelming, they're a bit daunting, but you will learn it on the way. And just try to be open more with your, like, even with ST2s, ST3s, and sometimes the more junior people, like the ST2s, they might be a bit more helpful, because ST2 is a year when you don't have any exams, and then you're done with your ST1. So they might be the best people to show you around, and they're more friendly and approachable. I think I really enjoyed my ST2 year. So just try to mingle in with your colleagues and try to be open and ask questions along the way. Not too many point, like if it's a really busy time, obviously not at that time if they are during on calls, but before that, like, during the daytime, you should be asking those questions, so that they also feel that they have time to guide you. Any advice for those starting in NHS for the first time? Yeah, again, as I said, just take it slow, have a proper induction, and just tell them straight away, I think, because it's your first NHS job, you will not be familiar with the system, how the pathways work in the hospital. I don't know, I've not worked obviously in lots of, I've done radiology training in 2 deaneries, and the training was quite different in 2 of them. So just be familiar with how the pathways work, how many CT scans you have, which sites you have to cover for the on-calls. All these things, all those numbers, they do have a directory. Sometimes you can download it in the app, so you have all the basic numbers. So these are like basic things. like, codes for different rooms or the locker rooms or even for the toilets or things like that. You should know these directions, because once you start the on-calls, it's really, you just feel like it's so much adrenaline and you just have to be on your toes. It's a lot of mental work. It's yeah. So I think Mohammed has answered another question about GIGU. Few people were messaged me individually asking, how will you guide if you're interested in one subspecialty which is quite competitive? Again, as same thing, discuss with your ES. Obviously, once you settle in, not on the first day, obviously after a month or two. And I think they will ask you themselves, like if you have a subspecialty interest, if you know what you want to do. So just tell them, and then just explore, join those societies. Like every subspecialty, they do have a society. So for example, I'm do neuro and head and neck, so I attend annual meetings of British Society of Head and Neck Imaging, that is BSHNI or BSNR, and most of them, they do like lots of monthly or weekly webinars also. BSIR is another for IR. You can go to lots of conferences, and again, you will have your seniors like ST4, 5s who are in the training, so you can ask them for advice, like what was really helpful, which helped them to get into the subspecialty spot. Mostly it's quite straightforward. I think in most deaneries you will get what you want, unless it's something competitive or lots of people are interested in one subspecialty. Which they obviously depends on the capacity where you are training. Okay. Yeah, Mohammed, do you want to add something else? Or
Yeah, just I think you've mentioned a very important point about asking for support when you start doing your own calls and other aspects of your training. It's better to ask for support when you start rather than just go and do some on calls and then some problems happen during the on calls and come back and say, well, I needed a bit of extra support or I need a bit of extra shadowing. The first thing that your supervisor will tell you is that, why did you mention this when you start? So you are in training. It is different from just great jobs. You have got all the support you need. You just need to ask for it. If you need extra support in a particular aspect of your training, just ask for it. That's my final advice.
yeah, and then one more thing is like, don't go with like preconceived notions, like how people are. That would be my general advice for anyone starting anywhere, because you will find different kind of people. You just have to be wary who you have to speak to. If you have any personal issues, like you can discuss with your ES, or like, just be careful, like especially for someone who is starting as a new starter. Just be careful, because also if you are being inducted at ST3, most of the consultants, they are not aware of the recruitment process. They don't know where you're coming from, if it's a different culture. And then, they would expect you to be at a level which is at least someone who is independent in doing their, as I said, as Mohammed has mentioned, in plain films or in ultrasounds. But if you haven't done a pediatric scan for a year, maybe 2 years, then you have to tell them, like, these are my deficiencies. I need to work on that before I step up for the on-calls. Or especially when you start off your nights, in some of the deaneries, you start them in ST4. So yeah, knowing your limitations is important, and the patient safety is always first. That is obviously the first rule. So, but then don't keep things prolonged for, like, halfway through your ST3, you're saying things which they would expect you to know when you start off. So you have to find the right balance also. So not to say, like, obviously it's a first NHS job, but then again, you just have to realize that you might have to put in some extra effort, because they will compare you with your peers, they will compare you with your colleagues, so you might have to put in that extra effort. So and then I think you should, because at the end of the day, it's more like it's patient safety, and did you do your job properly? And then we can't, there's no excuse for like, I was new to the system, that's fine, but then you should be able to learn those things in the initial few months, I think. Okay, is there a certificate for today? Yeah, we can see if we can generate, but this was more likely for your benefit. How open can one be about their shortcomings? I think you can, as I've mentioned, you just have to find the right balance. But as I said, 2 years of training, someone who is comfortable in reporting, like, CT heads on CT abdomens and basic ED stuff, you should be able to pick up first. So um, I think probably someone who is at level 2, who works under supervision, but not someone who is like supernumerary. Level 3 is like you maintain when you start your on calls, and level 4 they expect at least at the end of ST5. I don't think by ST5, mid ST5. So someone who is at level 2 for most of the things when you start off in ST3, I would say. And then, yeah, just to stress on one more point that, as Mohammed mentioned, don't leave your teachings and all these things towards the end. You have to do them. In some deaneries, they don't even accept the assessments which are done in the last month. And then you'll be looked frowned upon. So then just do at least try to do 2-3 assessments in every rotation. And even in every rotation, I think what I would guide is like do an assessment at this beginning. It's like a 3-month block. It goes really quick. And then do an assessment at the beginning, one at the mid, and one at the end of the block. So when you are sending the assessment, even at that time, you would see that there would be progress, and you would also see your own progress. So don't wait till the time like when you are to just towards the end, because sometimes the consultants, they're so busy, they might not, you just have to send them a lot of reminders to sign off your your tickets. So I would say just don't try to get just the bare minimum. Just try to get more extra so you have something in your portfolio. And especially again with the MSF, don't leave them till the last minute. At least by halfway through your ST3, develop a good rapport with your sonographers, radiographers, consultants, your colleagues, even like your reception staff. These are the people who would really help you when you're clueless, you don't know. So yeah. Okay, good luck. I think we have covered lots of things. Mohammed, you want to wrap up by saying something else? Or?
Yeah, good luck everyone with your start of your training. If you have any questions at any point, feel free to message us on the group. And I would appreciate it if you can fill in the feedback form so that we can prepare a better presentation for next year. And good luck with your training and have a good evening.
Okay, bye everyone. Thank you.